Welcome to the International Center for Journalists Global Health Crisis Reporting Forum. I'm Erin Stock, the Communications Director at ICFJ. Our forum connects journalists who are covering the COVID-19 pandemic with health experts, newsroom leaders, and each other. The English Forum alone has more than 3,200 people participating from around the world, and we have now expanded to include offerings in Spanish, Portuguese, French, and Arabic. Across all these languages, we offer around 6 webinars a week on topics just like the one you are here to hear about today. If you're on Facebook, look for the ICFJ Global Health Crisis Reporting Forum to become a member. And if you're not on Facebook, go to icfj.org and find our COVID-19 resources page. There you can sign up for newsletters to get the latest updates on our webinars. And please make sure to check out ijnet.org for a wealth of resources on covering the pandemic. So we are here today to discuss an important topic, the mental health impact of the COVID-19 virus and how to better cover it. As studies and health experts have pointed out in recent weeks, the toll of the virus is not just a physical one. People across the world are grappling with grief, isolation, economic strife, and more. Healthcare workers and those on the front lines of this work, including journalists, have been hit hard, as well as people with pre-existing mental health conditions. Antonio Gutierrez, the Secretary General of the UN, recently wrote in an op-ed that even without a pandemic, 1 in 4 people suffer from a mental health episode in their lifetimes. And he said, unless we act now, there will be enormous long-term consequences for families, communities, and societies. So to really dig into these issues, I am here today with 2 excellent guests, Dr. Jessica Gold and Zamo Mbele. Both are on the front lines themselves. They're actively seeing patients who are struggling amid this crisis. Dr. Gold is an assistant professor at Washington University in St. Louis in the Department of Psychiatry at the School of Medicine. And Mr. Mbele is a licensed clinical psychologist in Johannesburg, South Africa. He currently practices as a psychotherapist and senior supervisor at Tara H. Moross Hospital and at the WITS Donald Gordon Medical Center. For more on both of our speakers, please check the chat. So just before we begin, I have a couple housekeeping items. We welcome your questions. Please type them into the Zoom chat during our conversation. And if you're watching on Facebook Live, please just add your comments below the post. And as a reminder, this is recorded along with our other webinars, and you can find them on our YouTube channel. So let's begin. I'm gonna start with you, Zamo. What do we know so far about the impact of the pandemic on mental health, and what don't we know?
Thank you so much for inviting me to participate, and thank you to everybody joining. I think that the best place to start is the latter, is that we do not know a lot, actually. There's a lot of information that we are yet to really discover, let alone to fully understand. And because of the fluidity of the situation and the dynamism of it all, I think that it will be a long time until, to some degree, I imagine that we will be getting to know so much more 50 years from now. So to that extent, I guess we know that it has a huge impact, and it's having a huge impact, and it will continue to on everybody. And I suspect that the more we give away anything that will foreclose us, or the more open we become, the more we will be maybe even frightened or overwhelmed by the impact of it on people's mental health. In the most acute, at the most acute level, so where we are right now, as you were saying in your introduction, we do know that there's a great deal of distress. There's a great deal of being overwhelmed with what's going on and what's going to happen. There are high levels of anxiety. And I think we are only now beginning to really feel the depth of despair and the depression that is to follow. And all of this is in, by far, the general population. I work a lot with a psychiatric population. And there too, I'm beginning to see kind of increased symptoms. I'm even beginning to suspect the neglect that will come of that population as resources are being funneled elsewhere. So I guess I'm saying in a nutshell, which is a really horrible picture that I'm painting, that we know that it is terrible for now. And we know very little of maybe the benefits or the gains of it at all.
Thank you. And Jessie, could you add, I mean, what are you seeing in your work, and what data is out there?
Yeah, I mean, I can add what I think. I think there are some surveys, they're not great. The US does a lot of polling data. They ask a lot of data just to people. They call people, they have people fill out surveys. We see a lot of those in the newspaper. We see numbers like all of these people are distressed and all of these people are anxious and all of these people are sad. And they're, the most recent one was based on CDC numbers. It looked like 24% of people had symptoms of depression and 30% of people had symptoms of anxiety. And it was based on 2 questions, both of them, anxiety questions and depression questions, very broad screening questions like, have you been not interested in things? And are you worried? Those are really hard questions. If you asked anyone, they would tell you yes, probably. So I think if you were a researcher, you would tell me that that was a horrible screening method. So I'm not sure that we could say that we know much from that. But what we can tell you is what he said. People are scared, people are anxious, people are distressed. The numbers we know are not great because people haven't done the studies yet, because it's really, we're right in it. So it's really hard to do the studies when we're in it. If we were pushing data out right now, it would be bad data. People would be sort of like right in the moment pushing out these studies where they were like rushing to publication, and people would be criticizing them anyway. So I don't know that you would want them, but we do know people are distressed. We do know that it's affecting different populations differently. I do think you'll see it affecting different countries differently, different states differently, different cities differently in the US, because of how COVID affected populations differently, because of how it disproportionately affects specific groups, because of how it's affecting frontline workers differently, how it'll affect people with pre-existing mental health conditions. And then I do think what we see when we're doing work is also very different. So I do think that not everybody is distressed. I think I have seen people doing better. So I think there is that line, which is, I think we are painting a very, very everybody's sad, everybody's distressed, everybody's anxious picture. But there are people who are quite resilient, and there are people who even have pre-existing anxiety and depression who have been doing quite well. Like they have coping skills. They were prepared for this and actually have said to me things like, hey, I've had anxiety all along. Now everybody just does. This is awesome. Like now my stuff is grounded in fact, right? Like I always thought like I was anxious about not real stuff, but turns out there's the actual sky falling right now and everyone else agrees with me, So it's like, there are these 2 sides of the story, and I don't think we always hear the positive. And I also, as a mental health provider, do think that with everybody talking about mental health right now, it is a good thing, even if the rosy picture isn't that great, because maybe if we're talking about everybody being anxious, you might say, that's really distressing and that's really sad. And why are we having that conversation? But for me, there's a positive to that, which is maybe we'll actually do something about it.
And Zamo, what are you seeing in South Africa in particular? And Jessie mentioned certain communities being hardest hit. What are you seeing there?
Yeah, I think that as we were speaking, what I also realized, which I should say, is that and credit to the people who put this panel together, is that we also have almost like a timeline warp here, where in the United States, you feel so much far further ahead to where we are. So in South Africa, without getting into the statistics, in fact, I'll tell you this much, we've just hit 1,000 deaths nationally yesterday. And I think we've got just under 70,000 tests results type of thing. So we were quite a bit behind in it all. I mean, I've used an analogy, which I don't know how helpful it is, that if this was a series, we were kind of 2-3 seasons behind. So we now on season 2 going to season 3, whereas you're probably on 4 to 5. So we're learning a lot from you, And I must say, it's so helpful, actually. So it's so helpful to kind of look into the future and anticipate the fatigue that people will feel, to also anticipate how persons who make use of psychiatric services in particular, which is a lot of my focus, where we need to be supporting them best, including that actually and I hate to use this word, though there's a normality there's a normality that has come into their experience about difficulties going outside, difficulties socializing, etc. And maybe therein is something that is also a benefit, is that it has given an opportunity to articulate and put into words for very many people who may not understand what the difficulty of anxiety, of depression, even of some of the kind of psychotic experiences, what those might look like. We can get as close as saying, remember when you get this and that experience, it feels something similar. In terms of the populations that it's affecting, which is kind of at the heart of your question, we could have an entire hour on that, because I would need to kind of give the context for our population. And again, some really interesting inverses. I mean, our population is about 80% persons of color in South Africa, and which is very different, obviously, to the United States. We do know that the infections are seeming to be levelers. So at the beginning, we had more white South Africans being infected or reporting positive results, as well as deaths. And now it seems to have kind of leveled up. And I think the most recent look at the statistics is that there isn't any statistical significant difference at this point. However, the impact of it is definitely felt within the Black population. And I'm going to use that because that's how the vernacular that we use with the Black population, for several reasons. One of them, very briefly, is that we had a hard lockdown, and the South African condition is very difficult to have a hard lockdown. And most of the 80% live in conditions where to ask them to stay indoors is just unsustainable. And so that's the first. So the second one is that the economic impact on those people is also incredibly big. So, and maybe we'll have time to elaborate on it as we're going. What we know is that to this extent, at this point, while the actual virus seems to be affecting and infecting different races relatively equally, the impact of it is hitting the hardest on the Black population or the population of color in disproportionate ways because of the lockdown, because of the economic effect, etc., etc., etc.
Thank you. And I mean, as journalists trying to cover this story with a mental health lens, in the absence of sound data on mental health and how the pandemic is impacting it, what are the stories that journalists can tell, and how do they go about telling them in a way that is responsible?
I'm not certain. Okay, I'll start. I mean, I think that I've been thinking about that quite a bit around the responsibility of it. And I hope you'll allow me, Erin, to speak also about the responsibility that we have as mental health care providers to journalists, because that's quite a topic. I think that related to that, there's something of a strange situation where we are asking our colleagues, our journalists colleagues, to create a narrative where in fact there is no narrative. It's something very difficult and near impossible to narrate. How do you kind of create a linear something or sequential something when it's so new and it's so fluid, and in fact it makes no sense to some degree? And I think that that's the first place that I think is important to begin around what is the responsibility, is the awareness that there's a lot that is going on that may not fit in the regularity of how to report, what to say, and what to do in a huge way. And to this extent, I suppose part of why I start here is a recognition of how difficult it must be a task actually to be reporting under these circumstances. So everything that I say further is not because I imagine it's easy, though it's something to offer. One of the thoughts that I've had in my kind of observation is when it comes specifically to mental health, and I think Jessica was touching on this to some extent, is that I've been really impressed how our, journalism has really helped galvanize the spotlight on mental health as opposed to mental illness, which is not always the case, the promotion of it. And I think that that is something that we can perpetuate even more. The speaking of mental health and mental wellness and mental wealth in particular, that can be in this present day and going forward. I do think that perhaps there is a caution around the reporting of illness that is being put to the general population. At the beginning, I myself was encouraged that a lot of people were being encouraged to look out for anxieties of depression and symptoms of anxiety and depression. However, my concern is that into the future, it will dilute the actual severity, the fact that these are serious psychological conditions, that these are serious psychiatric conditions, and it also has a potential to dilute the conversation of them, especially because we know that as consumers, we get exhausted with narratives. And I think in that regard, we need to be quite careful and quite cautious on how we're reporting it. And lastly, and part of this dilution, is also quite cautious in knowing that everybody is struggling. It may not be to a severe anxiety or severe depression difficulty, because that will then make it difficult for those who are experiencing those syndromes to know where and how to reach for help. In fact, we also know that a lot of people have the resilience to keep going.
Yeah. I mean, if I can add a little bit to that, I mean, I think when I look at stories, I don't envy journalists. I mean, I write some in my free time and it is really hard. I think conveying the nuance in a lot of data is really hard because people aren't that interested in the nuance, and there's a lot of it. Like when I was talking about how those studies that are polls are based on 2 questions. Nobody cares that they're based on 2 questions. They care how many people are distressed. That's interesting. It's a big number. That's interesting. And I think it's really hard to then be like, but it's not that interesting because the data's not that interesting, you know? And I think it's the balance of that is hard to maintain because it just is, but to the best of your ability to try to do that would be very helpful, because I think there is an extra layer of panic and anxiety that comes with this fear that everybody is really distressed. I do think that is additionally worsened with this. I've been dealing a lot with this deaths of despair argument, which is that there's going to be this huge increase in suicide after the pandemic, but it's suicide overdose deaths and deaths from alcohol. And it's a really bad argument because the argument is based on data that's been going up for years. We've known it for years. They're taking the data that we've been following for tens of years and saying, look, if you take this data and you extend it, it will get worse. Well, there are lots of risks in this pandemic to mental health worsening, but the thing about risks is you can mitigate them, which means that we actually have things that work. We actually have ways to prevent things. We actually have treatments. We actually have interventions. We actually have evidence-based methods to help people. And that tends to be left out of the conversation a lot. And we tend to be in this very like doomsday, if we don't help by opening up the country, everybody's going to die of overdoses and alcoholism and suicide. That doesn't make any sense. And so I think we do need to realize that, like, I understand mental health can feel sort of obscure sometimes, but we have been working on treatments and we have been working on prevention and we have been working on ways to really help people. And suicide for sure is not a foregone conclusion. Overdose is not a foregone conclusion. So if you could look at data like that, and even if you look at the report that the very nice people who actually made that data set intended, they didn't say it was a foregone conclusion. They said it's a risk, and they didn't want it to be used like that either. And they were really upset that it was. So I think if you could just like kind of think about the nuances in that and try to think about how can we prevent it? How can experts talk about this? How can we talk about treatment? How can we talk about ways that mental health can be used as a way to bring people together? How can communities support each other through this time? And think of ways that like other people are being left out of the conversation, I do think that the story will be more robust. And that's the stuff that I do think is missing when you just report on these sort of huge stories that feel really intense.
Zamo, did you want to add to that?
I mean, I myself got passionate when I was listening to that. And one of my passionate thoughts that came to mind is that I do, as an advocate, I suppose, too, of mental health, I do think that there's a caution here where mental health as a narrative, as an institution, can be used to almost weaponized for the purposes of certain agendas. And then those who will lose are the mental health care users and, in fact, the general population. So that weaponization is something that is so easy. You see it when there's a crime or there's something horrible happens and they have to be reported that this individual was being seen by a healthcare provider or had a diagnosis or whatever, and it can be used in this regard too. That anyway, etc., etc. And I think that the awareness and the caution for that is again quite nuanced, so incredibly important.
And we have to acknowledge, I think, that the way that journalists are covering this story, is part of the feedback loop, right? In terms of how people are processing the pandemic and what's happening. So if, as journalists seek to cover the pandemic and cover it well and help rather than harm in their reporting, I mean, what are some of the things that matter when it comes to the way a story is covered and whether it does help rather than harm?
Yeah, I mean, I think so. One, I would say I looked at, there's a Carter Center report on this where they looked at how to best be a journalist that reports on mental health. And I spent some time looking at that just to see if I could give you guys like good tangible tips. But so the things that they said are, one, look at whether mental illness is actually relevant to the story. This is interesting to me because I think when you read stuff, I never really thought about this, but it's totally true. A lot of times we mention like so-and-so had a history of mental illness and it actually has nothing to do with the story. And then all it does is sort of cloud the narrative or stigmatize mental illness in some way because the story you're trying to tell is negative about the person or it's something else. So make sure that why you're telling the story is actually something to do with their diagnosis and has actually something to do with prevention or treatment or something. There's a reason you're talking about their mental illness. The second thing is when you're talking about their mental illness, make sure you actually know that they have a diagnosis. So did you ask them? Who's the source? Did it come from just like the cops? Like, is it made up? Like a lot of times it's hearsay, and that doesn't help either because it's not really helpful to guess. Invented diagnoses are not helpful either because that just kind of puts a label on someone that is not a true label, and labels don't help anyone. Another thing is like making sure that you're being careful with the language you use. So we're pretty careful at saying things like a person with a diagnosis instead of a schizophrenic. We don't like words like psycho or lunatic or crazy. We don't like things like being careful about saying things like insane even when you're not talking about mental illness in other stories, being careful when you're using words that could have any sort of derogatory stigmatization of mental illness. This especially goes for public figures. I know that there are lots of public figures that we like to slap mental illness diagnosis on. That doesn't help anybody. It doesn't help either side. It doesn't help us. I understand that it might be helpful to people to try to have an understanding for why people do things that they do, but oftentimes people are just bad people and it has nothing to do with mental illness. So it doesn't help us when you do things like that. It actually really hurts us and it really hurts our patients. So trying to do stuff like that is not helpful. And it doesn't help political goals or agendas either, and on either side. So those things are not helpful. I think really focusing on things like prevention, which is barely mentioned, treatment, which is barely mentioned, that people can get better. Recovery is really important. So I think especially with things like addiction, with things like suicide, I think we talk a lot about the negatives. So we talk a lot about how people are really struggling with the opioid epidemic. We talk a lot about how people die from suicide. We don't talk a lot about how people attempt and get better. We don't talk a lot about how people have families that like put their kids into treatment programs and get better. And a lot of those narratives and a lot of those stories are important because it shows that like getting help and asking for help is effective, right? And that's why we do what we do. And that's what is important about what we do, right? And if that stuff comes out in the press, then somebody's gonna say, wait a second, like I have those symptoms, I have that problem, I should ask for help because help works. And as a psychiatrist, I'm also would be remiss to say that medication has a horrible rap. So like we talk about therapy all the time. Therapy has gotten pushed into wellness. Therapy is in the wellness sphere. Everybody likes therapy now. Maybe not, it's like, you know, I'm gonna go to a spa and I'm also gonna talk to my therapist. Medication is still very highly stigmatized. We get like, there's a huge anti-psychiatry movement and we don't push meds on people. We like very much think about why people need medication. If someone comes to me that does not need a medication, I am not going to give it to them. I'm going to talk to them about therapy. And I think that message tends to be left out of the conversation and we're looked at as still very bad people to a lot of people. And it's very hard to convey. And that's why I do a lot of this stuff. It's why I'm on social media. It's why I write. And I think that message tends to be left out. So anytime you can talk about people being on medication and doing well and not doing poorly and not having horrible withdrawal and being unable to deal with their medication would be a plus to me as well.
Thank you. I think what you're speaking to a bit is something called solutions journalism, if you're familiar, which focuses on investigating how a solution was found rather than, you know, the source of a problem. So Zamo, what were you going to add to that?
I mean, I really think that that was a thorough enough kind of response, and I myself have learned. I don't want to add very much more or even potentially paraphrase, though definitely the determinism that can oftentimes be used in reporting can be quite unhelpful. So I'll give you an anecdote. I mean, I was recently giving input for a group of reporters who were going to write about should kids be going back to school, or should young people be going back to school? And I could tell that because of the narrative that I was trying to be fit into, that I was clearly being obstructive to, it was not going very well. So there was a determinism that said colleague had in their investigation that said children that stay at home get fatigued and they get this and they get that, which will lead to X, Y, and Z, right? As opposed to the nuance of can and could, to some degree, though very certainly, incredibly importantly, something that else that Jessica was saying that, and the results or the response is not predetermined by the overall to go to school or not. There are interventions that are available to you in the home too, that can also deal with that. So I think that complex determinism and that kind of fusing of confounding variables at the best of times is something to look out for. My last kind of thought on that, and I'm not certain if I'm jumping the gun a little bit, is that I think that there can be a lot more space for a type of collaboration with the media and journalism that is kind of just purely insightful. So I, for one, have absolutely learned so much. I mean, I do have a bit of a journalism, I have a media studies background. So I certainly kind of, even in the work of the very many last years, have myself learned so much. And I think that it can be bidirectional in a huge way. Absolutely. So that there isn't the risk of another colleague who either is weaponizing or is misleading or misinforming and giving that information out, you know. And it's a lot to ask, because you cannot be asked to be custodians of all areas of interest. So definitely, I think that a closer collaboration beyond these kind of crises is something that I would certainly have an appetite for, and would say that I think it would help so much with how we continue to collaborate in reporting.
Thank you. I would like to bring up sort of a different but certainly relevant topic, which is, the fact that amid this pandemic, there are other crises happening around the world, and personal crises and larger societal crises. And here in the US, there has been such a focus in the past week or two on the unjust killings of Black Americans. And it's, Zamo, I'm not sure if you're getting as many headlines as we are on that in South Africa, but it has absolutely seized our news cycle here. I was reading about it and thinking through this, and it's high profile and it's horrific violence. And without a doubt, it must be compounding some of the despair that people are already feeling, that people live with on a daily basis in the form of racial trauma already. So I think it'd be remiss not to bring up this topic, and also others that, how do you think through the fact that this pandemic doesn't exist in isolation, and that, there are people who are dealing with multiple traumas at once? What can be done to better help people dealing with those particular, complexities, and what should journalists think about when they're trying to cover that?
Yeah. I think that a very inappropriate, well, in terms of its timing now, adage or whatever, is that the US is so big that when it sneezes, the rest of the world catches a cold. And I'm not so certain if that's kind of familiar within the borders and boundaries. But definitely, it's so true. I mean, our newsfeed has been full of what is happening there in a way that is interesting. It's very interesting. Though the sneeze cold kind of relationship in this regard is about trauma and triggering. Because of course that in South Africa, there is almost a trauma response that is so personal to our history and our persons that is we living through at this point. So there's then, I think, an opportunity for a deep relatability and a deep identification in the pain and the process that you're in. And I think it's quite important to punctuate that in a huge way. And the support and solidarity that is coming from South Africa is not just by virtue of the knowing police brutality and kind of in a modern day situation. It is absolutely because of our wounds and scars too, around race-based violence and hate crimes et al. In a way. So I cannot emphasize enough how much we identify and are in solidarity in that regard. I think what has also been very interesting, and if you'll allow me a minute, is that I think that we can definitely see it in the way that this has added fuel to kind of a already inflamed situation, society, collective, and has worsened situations in many ways. Though I do think that there is an additional opinion that says that I think the responses that we're seeing are also a result of the pandemic and the crisis. I think that there is something about a frustration, there's something about a cabiness, there's something about an enragement, a powerlessness, a hopelessness that is also adding, in fact, to the current response. There's also something, and I think here I'm trying to maybe be a bit too hopeful, about a solidarity, a togetherness to some degree in some sects of the protests and the responses that I think is symbolically appropriate, that actually, even when there is this divider and leveler and the separator in reality and in otherwise, there's something that I think feels good about coming together, even though it's painful still. It's kind of the coming together, the showing solidarity, and the reminder that there is a collective that is existing still and that will exist past this pandemic. that I think is also playing out at this point in ways. So those are kind of, to some degree, some of my heads of argument, all of which I think we could elaborate on a lot more though. Yeah.
Yeah. I mean, when I think about this, I think, you know, when we as mental health providers think about mental health, we always think about all of the factors that come into it. So we always think about mental health as the biopsychosocial model of things. So how does someone's biology and everything influence them? How does someone's psychology influence them, and how do the social factors? So we've always thought about this. So race to me has always been in the picture. It's not new. However, I am glad that other people are thinking about it. I am a white person. I'm aware of the privilege to be having this conversation with you as a white person. I will put that out there right now. But I'm not blind to that conversation, because as a white person in a field that does not have a lot of Black people, I think about 2% of psychiatrists in this country are Black. I have to see Black people because they need care. And even if they want to see Black psychiatrists, we don't have enough people, right? And that is a problem. We need to fix that. We need to fix the pipeline, and that's on me to help fix. And I think that also means it's on me as a white provider who needs to be someone that Black people can feel safe to go to understand these issues as best as I can. And I've worked really hard to try all along to understand these issues, and I'm not perfect. Nobody's perfect. It's impossible to be perfect, right? And I think I've asked my friends all along with this stuff. I've struggled with this stuff all along, and I'm going to continue to struggle with this stuff. But I think that's what we need to be doing. And I'm really glad that other people are starting to do that, frankly. I think, you know, it's good to see that that conversation is coming out of colleagues besides me in my workplace. I think that that's been positive for me. I think when we're having these conversations in journalism, I think what you need to be thinking about is, yes, there are 2% Black psychiatrists, but you can find them. And if you need me to find them for you, write me and I will find them for you. You can find them, and they should be the ones that are talking right now. And that is the truth. And there are Black psychologists that can talk about the trauma, and there are Black social workers that can talk about what's going on. Those are the people that should be being interviewed right now, and anybody who says differently is wrong. So you should be interviewing them right now about what's going on, because all of this is affecting them more. So they should be talking, and we should not be. So if you are having a story and it has to do with anything going on right now, those are your experts, and that's who you should be amplifying. And anyone who says differently is wrong. So come to me. I'll give you expert names. I'll pass you on to other people if I don't have the right people. I think that's something that we should be doing as people who know people who work in this field right now. This issue, the pandemic has been disproportionately affecting people of color in our country as well, just as it has been in South Africa. I think as a person who works with healthcare workers, this is disproportionately going to affect their mental health, because they've been seeing people of like Black people being disproportionately affected on top of it. And then seeing race, the issues of race being played out in the media while also trying to do their jobs, it's just going to be disproportionately affecting their mental health as well. So I think centering their stories is really important. And by centering their stories and asking them to be experts, being aware that they also have their own mental health struggles with the current moment, and being aware of that and being mindful of the different things that they're being asked to do in this moment, all are things that as a journalist are really important.
Thank you for that. And yeah, I mean, you make a great point about sourcing and who we're including in stories and who we're leaving out. So thank you. Just a reminder, we're taking questions and from the audience, type them in the Zoom chat or on the Facebook Live post. We do have a question for you, Zamo, on what can we learn about mental illness in a pandemic from what South Africa has experienced in the HIV/AIDS crises? Are there similarities or differences that you see?
Yeah, I mean, thank you for that question on the one hand, and at the same time, it's such a complex one that I might stumble and fumble in order to respond to it. I did a lot of HIV and still do a lot of HIV and AIDS work in South Africa for very many reasons. One of the places and spaces that I think I'm seeing a real surge in terms of the similarities is the terror of infection. And I think the terror of infection is a global experience, though in South Africa it's particular because of the awareness and the fear of treatment and response. So where South Africa is also, and I'm ashamed to say this, really unique from the rest of the world is that we have so few resources in our mental health care, public mental health care space to actually respond to this. So the stigma is not just about being infected and sharing or transmitting or infecting others. It's a terror of actually getting the treatment. The stigma is also about where you're going to get treatment. We have, as is most places in the world, a two-tiered system between public and private. And people are terrified that they're going to get infected and have to go into a public healthcare system, which is really struggling in a huge way. Though there is absolutely also the conversations around stigma in a post-positive test situation where people are having to come back to work. They're having to reintegrate into societies and communities. And there is the stigma that is ostracizing and further isolates and has the potential to really traumatize an individual who has already been through quite a lot. And that is incredibly massive. In fact, we've seen it almost textbook HIV/AIDS case where people are hiding from testing, and then they're hiding their positive tests and are eventually hiding a kind of post-recovery because it's so difficult actually to reintegrate. And a huge part of that is actually, it is a residue of the HIV and AIDS pandemic in a way that we are only beginning to understand. We're only beginning to understand that in South Africa, to be sick or to be ill has had such an inherent impact on how we think about it, that we're seeing it play out in this particular regard. The last one that I'm actually also particularly concerned about is that we also obviously saw quite a lot of child-hated households in South Africa and I think in Africa quite a lot. And there's a huge awareness and maybe a terror that is what we're going to be seeing too, once we really take stock of the impact of this in our country and on our continent as well.
Thank you for that. That's incredibly interesting. So we've talked a lot about the stories that journalists can tell, the challenges of telling those stories. On a more focused note, in terms of the reporting process, you know, journalists are on the front lines themselves, and they're often the ones talking to frontline workers. They're talking to people who have lost loved ones from this disease, and other people deeply affected. I think I saw where a piece showing that, you know, more broadcast journalists are showing emotion on screen than we've seen in the past, having a hard time, like, you know, not being moved to tears. So I have a two-part question, which is one, you know, how can journalists navigate that? And, you know, certainly they do it in a day-to-day basis in the work they do, but any tips for how they can navigate interviewing people who have been, you know, who are struggling? And secondly, how can they take care of themselves while they're doing this?
Yeah, I mean, it's really interesting. And probably until this pandemic didn't realize how much journalists are like psychotherapists until I started watching the news and realizing how much like you guys really do interview people who have been through just really hard stuff, and you do it in front of people, which just scares me. I wouldn't want to do my job in front of people watching. And then I talked to some reporters and they told me, you guys don't get a lot of training in how to do that either. And you don't get a lot of training in, especially if you don't go to journalism school, in, you know, tolerating trauma or talking to people who've been through trauma. And I mean, that's all we do in psychiatry training and therapy training is like, how do you talk to someone who's been through trauma, and how did that feel for you, and what was that like? And I first of all want to say I appreciate what you guys do, and I couldn't do that without all of the background that we have in that. And I think that, you know, first, one of the things to know is that it's okay to have emotions about this stuff. It's really hard. What you're listening to is not the kind of stuff that most people share with anyone. I think you have to say that out loud, and you have to acknowledge that. I think if you don't, it is not a fair statement. Like it's not normal for people to talk about people that died. It's not normal for people to talk about the really hard things that happened to them. It's not normal for people to talk about war. It's not normal for you to just hear that over and over and over and not have a reaction, right? And it's okay to do that on screen and be okay with sort of, this is work me and this is after work me. But after work, you has to process that. Because if you don't, it will start to eat at you. And that's what we talk about in our job, which is that you can do your job without crying. I do my job without crying all the time, because it just is. That's kind of who I am in my job, is I am me, and I don't interfere with what my patient's saying, because that's who they are to me. They come in, I'm not bringing me into the session because they don't want me to. They want me to be able to hold them and hold their stuff without my stuff interfering, right? That's who I am in the room, right? Outside the room, I'm me. And me, that was hard to hear. That was not an okay story. That was not a good thing to know. I don't want to know that that happens to people. And I need to be able to say that, and I need to be able to process that, and you guys do too. And so if that's talking to friends and family that can handle it, that's a thing. If that's talking to a mental health provider, so is that. And you need to be able to do that, and you need to have an outlet for that. And you need to figure out what like self-care looks like for you, because otherwise all you're doing is holding it in, and that's not okay, because it just builds. And what that starts to look like is bad coping skills, starts to look like not sleeping. It starts to look like drinking, because it's easy to do, because that's like a calming technique. That's not really a good one. Starts to look like, you know, sort of ignoring feelings until they sort of all come out, which is probably why some people do cry on screen, is because they didn't deal with it. And I think, so try to figure out what things work for you. Try to figure out even sort of quick coping. Sometimes people like mindfulness because it brings you into the moment. Some people like meditation for that. Some people like reading books. Some people like watching silly television. Whatever it is, like have a list of things that you can do, like both on assignment and not on assignment, that are relaxing for you, that maybe just can bring you out of your head and out of like that emotional self and into like a way of processing. Maybe it's journaling. Whatever it is, figure out what those like different coping skills are that work for you. Figure out if you need to have a therapist. I have one. I think it's really important. It really helps me do what I do. If I didn't have one, I wouldn't really be able to do what I do and do it well, I think. And I think it makes me better at what I do. And I think probably most therapists and psychiatrists would say the same thing. And that's very integrated into what we do for a reason. So I would highly suggest that.
Zamo, what would you add?
Again, I mean, I think very little. Perhaps the one thing for me to say is, I think it's quite important for the work that could potentially be done by all of our media and journalist colleagues, to the extent that it will not just empower them in doing their jobs. I think in being able to interview, in being able to narrate stories, I think what it can do is almost insulate or recruit a resilience internally, actually, that will be incredibly helpful to a huge extent. And look, sometimes it is something formal, and at the best of times, it might also be this interaction and engagement that allows you to be primed to the fact that one of the signifiers of something being traumatic is your appreciation going into it to some degree. So, how can I think that there will be something tacitly given in this conversation that says, yes, it is traumatic, that will in fact be a protective factor. And I think that's something small that can even be practiced in the covering, reporting of every single story, is the going into it with the appreciation that this sucks, this is horrible, this is hard, this is painful. And it goes a long way into actually being a protective factor to how you engage the story and process it further. It's incredibly important. And to the extent that it's possible is also to know the resolution of it, and where possible. Anyway, I think because I'm aware that in the comment section there's a great recommendation of a book, and with regards to that, I want to link it to what I'm saying. We have a famous journalist I suppose we have quite a few famous journalists, though. One particular journalist is Kevin Carter, who died from suicide and of suicide. And Kevin Carter, one of the angsts that he lived with was never having known what happened to the story that he had initially written, to some degree. And I'm not saying that that's, it's not the whole story and it's not the full medication, though absolutely it's resonated with me around that, is the capacity where possible to know how it resolves, and if there's a resolve. And that doesn't mean that the story ends, though it might be the follow-up that says this is where things are. That's incredibly important. And lastly is something about symmetry. So again, one of the things that I've spoken about during this time to everybody is the importance of a symmetrical response. So when we find ourselves in a once-in-a-lifetime global crisis, we can imagine that the pressure and the distress that comes of it is immense and intense. And I think that we need a symmetrical response in terms of self-care. It cannot be that you imagine that you're going to do the things that you used to do when life was ordinarily hard. Now it is particularly ordinarily hard. And so you have to symmetrically be particularly deliberately kind and compassionate to yourself. And this applies specifically then to frontline workers, which in this regard is also journalists. It cannot be, in fact, that your self-care, your preservation techniques, and everything that you do is baseline normal. It actually has to be deliberate, and you have to recognize that because of what it is that you're doing, you also then need to do something that is equivalent and concomitant in order to look after yourself in a way. Yeah.
So one thing that that the Secretary General said in his op-ed that I referenced earlier is that the mental health impacts of this pandemic could very well live on beyond the physical ones, that it's something we could struggle with for years. And at the same time, we have a resource problem because there aren't a lot of resources, even before the pandemic, right? In both South Africa, and I'm sure you mentioned earlier, Zamo, the limitations, and in the US as well. So what's the way forward? I mean, when you look at from a systems, standpoint, how do we actually meet the demand, the needs that are going to bubble up and linger and have other consequences for us as a society? Big question, but any thoughts on that?
Yeah, I mean, in an ideal world, we take the system, shake it up, and throw it away. I mean, I think this is like, if you're ever gonna have a time to do something, it's now. I've never been more, like, no one's ever asked me about mental health more in my life. And I think that to me is a sign that somebody cares. And I'm hoping that means that that's gonna do something. I've been hopeful before in the US, that's been after mass shootings, that somebody is going to invest in mental health, that somebody's going to do something about mental health. But this is a different feel because it feels less like a scapegoat and more like a plan. And I feel like you're right. We don't have enough resources in the US either. You've seen basically demise of our entire healthcare system through this, and you've barely begun to scratch the surface of what is going to be a very taxed mental health care system, because of nobody can afford it, because now we have people who are on unemployment who are definitely not going to choose to pay a mental health copay, who we do not have enough providers in this country. And so there are definitely not going to be enough people who will be able to serve the population in need. And so we're going to have to be creative, and be creative fast. And some of that is going to be like, how can we use technology to our advantage? How can we, knowing that then we need to be thinking about how to equitably use technology. So how can we then get technology to the people that don't have technology? So how can we think about getting Wi-Fi and tablets and phones to people who can't afford them? Because that is a big, big barrier. I think we will be creative, and that'll be interesting to see what comes out of that. But I also think what will be most exciting and interesting to me will be like, can we build and cause sustainable change to these things that have been long time barriers to change in our country and other countries in the mental health care system that shouldn't have been there. Like for years, like even just like for us, like telehealth restrictions for like getting paid and reimbursement have been there for no reason. And all of a sudden they just said, well, we're just done. We'll let you pay for that now, just so that like we can cover it for the pandemic. And all of a sudden now we can do that. We can do telehealth across some state lines. Like that's a huge change, which we've probably been pushing for years, like with a little wave of a magic wand of the government, right? So all of these things that we've literally just been waiting for, that have just been really hard for no reason, if they could just sit and go, why do these things exist? Because that is what has been a barrier for no reason. Like, can we just go, why do these things exist and why are they barriers and can we change them? I would be so happy, because we could make big changes, and some of these things are they're not even hard things to change. Yes, there are hard things to change, like the entire mental health care system, and putting money into it is a big change, but there are little things you can change, like that, little regulations that would make a big difference. And I'd love to see some of that happen, and happen quickly.
Great. Zamo, do you want to leave us with your response? We're coming on an hour.
Sure. I think that, okay, let me start with this one, and then maybe we'll get on to quite a nice kind of positive one response. Is that I think that some of the changes in the innovation is really about collaboration. You know, I think even if it's just because of a recognition of how small a community we are, mental healthcare providers, even if it's just from that, or something I think a lot bigger around that fact that advocacy takes numbers, we need to recognize that we cannot do it by ourselves. I would be much happier to spend an hour doing this conversation with the appreciation that I'm spreading the word, the awareness, and to some degree, hopefully some insights that everybody on this call, 27 plus people, can take it further. Because that's kind of some of the innovation that we will need to be doing in order to reach the population. The mental health care workers are custodians to some degree. And at the same time, we absolutely need to open things up. And I think for some in my community, that's going to be very difficult. Though any sort of trying to be territorial about it in a way that is that does not serve the population is going to be detrimental to the population and to actually our group. So we need to be speaking as much as possible to as many people as possible, to be capacitating, not to be afraid to say a huge part of my job can be done by a lot of other people. And I'm not going to be sacred or kind of thinking about it. I'm going to try and help where possible, spread the word and say, this is how you can do it. The last point, hopefully, which has a little bit of hope, is that thank goodness we can also have innovation in crisis. And it's a pity that it took a crisis to create innovation. Though I too, like Jessica saying, I'm quite excited about the innovative positions that we have been pushed into. Not just an innovation around how do we speak in a way that is accessible, though I think concrete innovations too, around insurances, around accessibility, et cetera, et cetera. And I think it's forcing not just us to think about it, though even people who had not thought about it until a few months ago to do that. And then that's exciting. And then I'm quite quite excited to see what it is that we come up with after this pandemic, because there has to be an after.
Thank you. So well said. I want to thank you both. I think you did achieve what you set out to do, and hopefully we're able to help a lot of journalists and others who are listening today. So thank you to both of you, and thanks to everyone who joined. Before you head off, I want to make a plug for our Journalism in the Pandemic survey. So we're surveying journalists around the world in partnership with the Tao Center at Columbia University to find out how the pandemic is affecting you and our field. It actually does include questions around your health and well-being as well. And we want to use that data to develop ways forward to get into the after, as Zamo so eloquently put it. And following this webinar, you will receive a short survey also about today's event. And if you could fill it out, that would be great. Your feedback is very important to us. Thank you again, and have a great day.
Cheers, everybody.